The Madison County Board of Education meeting special session for Thursday, October 14th, 2021 is called into session. Mr. Brooks, would you mind leading us in prayer?
Dear Lord, Heavenly Father, Lord, we thank you for the opportunity to serve through you. Lord, just be with us tonight as we make decisions. Thank you for all the things we ask in your name. Amen.
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 Before we get started this evening, I'm just going to remind everybody about the expectations. Most of you have been here before. Welcome back. Is anybody here tonight that is not requested to address the board? Okay, sir. So because you did not, our policy is 72 hours prior. So if you're interested in addressing the board, we have a sign-up sheet in the back. You can do so and sign up to address us at our next meeting on the 28th of October. Okay? So we'd be more than happy to, and we would hope that you would sign up and come back in and address the board. There's one thing I did want to address to you all this evening, and before we start, and it's the recent media coverage that's surrounding the National School Boards Association, or the NSBA's request to the Biden DOJ for federal law enforcement to crack down on threats of violence and acts of intimidation directed at local school boards. The Alabama Association of School Boards, which we are a member of, last week sent out a letter to all of its members and joined other school board associations nationwide in distancing themselves from the NSBA request, and we, the Madison County Board of Education, echo that. Oop, this is not wanting to come apart here.
Thank you. Appreciate it.
You're welcome. We won't tolerate, obviously, acts of threats or actual acts of violence directed towards anyone. The board does not believe, but we don't believe that anyone here in this room or any of our stakeholders, parents or otherwise, would commit or threaten to commit an act of violence directed towards us or the district as a whole. That the need for federal enforcement against those that do so is what we believe federal overreach, and any legal action against those that do commit acts of aggression and violence needs to remain at the local level for local authorities to handle. The NSAB characterization of events that have happened is not universally occurring throughout the country, and to my knowledge, it has not happened here in Alabama. We affirm that you, as parents and taxpayers of Madison County and Madison County schools, have the right to address this board, air your grievances, state your opinions, and even, yes, direct your anger towards us if need be, all the while doing so in a respectful manner. We truly do appreciate your presence here this evening and at all meetings. It suggests that you truly care about your children and their education. We only wish that more parents and the community participation would happen in our meetings more often, and not just when there are hot-button issues. Again, our agenda is full this evening. You will be given the opportunity to speak here momentarily. I ask for your assistance in helping you make this meeting a productive and informative meeting for all, and we thank you for your cooperation. Mr. Perkins, I yield the floor to you.
All right. I recommend approval of the agenda dated October the 14th, 2021.
Motion.
Second.
I have a motion and a second for the recommendation and approval of the agenda dated October 14th, 2021. Any discussion? Any amendments? If there are none, all those in favor say aye.
Aye.
Aye. Okay. So, to that, we'll go ahead and get to the request to address the board. Okay, real quick, I got to read the obligatory rules. The comments will be limited to 3 minutes. Ms. Thompson, our attorney, will be the gatekeeper on the time. In the event you wish to address the board on an issue that involves the general reputation and character, physical condition, professional competence, mental health, or in some instances, job performance of an individual or confidential student information, the board will hear your comments in executive session. Please advise us that when you step up to the podium. And if you are unsure whether your comments should be made in executive session, when you advise us, Ms. Thompson will advise us as to whether or not we need to move into executive session. So we'll begin this evening with Ms. Belinda Newell, if she is here. She's not here this evening? Okay. Claudia Gilbert? Okay. Ms. Brickhouse, Hillary Brickhouse? Ms. Brickhouse? Let us know when you're ready to start, and we'll begin the time.
Okay. I'm a teacher at Buckhorn High School, and I can no longer remain silent about how your COVID policies are detrimental to our students. The first week of school, my students flourished. They asked questions, they participated in group work, they socialized during break. But now, since we've had this mask mandate, Many students walk to class with their faces down. They do not socialize with their friends. As a teacher, I am begging students to answer questions in class as their faces are covered by a mask. Students are not participating in group work with the same enthusiasm as they did the first week of school when we were mask optional, or even the past 10 years of my teaching career. We just met with our Health Science Advisory Board. One of the things we discussed is that our students have lost the ability to communicate. When a person won't quit talking, how do you make them quit? You cover their mouth. Our students are no longer communicating because you are covering their mouths. Multiple times throughout the day, I have to get within a foot of a student to have them to repeat multiple times what they are saying so I can understand them through their mask. These mandated masks silence our students. My students are wearing a mask for 7 hours a day with only a 23-minute mask break for lunch. And if they ride a bus, add an hour. Are you wearing your mask from 8:20 to 4:30 every day for 5 days a week with a 23-minute mask break for lunch? If a high school student is struggling as much as mine are, can you imagine an elementary student trying to struggle to read through a mask? What are you doing to our students' mental health? Healthy kids have a right to be in the classroom. This year, when kids are excluded, they come back with multiple zeros and are a week behind in assignments. Last year, BHS saw a 10% increase in student failures. This means we have 256 failures at BHS from last school year. We are trying to get caught up this year. Last year, BHS quarantined over 700 students for exposure, and only 17 tested positive for COVID. 700 healthy students were sent home, and only 17 tested positive. Healthy kids have a right to be in the classroom and learn mask-free. This data shows that social distancing, masking, and excluding kids from school is not in their best interest. Yet here we are repeating it all again this year. Stop excluding healthy kids. When have schools ever excluded healthy students from school? Much less a virus they have a 99.997% survival rate from. Alabama Department of Public Health has given you guidelines, not mandates. This is your choice what to implement. You are not choosing what is in the best interest of our students. These mandates have to stop now. Stop sending healthy kids home. Move schools to level 0 and return masks to optional.
Thank you. Thank you, Ms. Brickhouse. Mr. White, Todd White.
I have some pamphlets here. Can I hand these out to
Sure.
everybody?
Yeah, or you can just give them to Mr. Curry, he can pass them down.
I only have 5, so I'm sorry. I apologize. I didn't bring out enough for everyone. So, is it right if I start?
Yes, sir, go right ahead.
Okay. If you look, the first thing I gave you, it is actually from the Alabama Department of Public Health.
Talk about that.
And it gives their actual face mask recommendations. And it shows exactly how to properly doff a face mask and what to do and what to not do. So if we go from there and start looking, and I thank everybody because this is from the Teacher of the Year Awards. I took screenshots of everyone in different positions, and the first one was Steve Bell and Tim Hall. Next is Dave Weiss walking out with his face mask in his hand, not on his face. Next, a picture of him at the podium with his face mask in his hand. Then after that, he is then touching the podium with the exact hand that his face mask was just in. Clearly a violation of how you're supposed to properly don and doff a mask according to the ADPH's website, which is guidelines you are following with our children. Here's Dave again, walking off again with his face mask in his hand. So if this is in fact so dangerous and deadly, why is the school board not acting the way they expect our children to act? If you go down later on, I have, I'm sorry, I forget who this is. Whoever announced the MC was, whatever his name was, Mr. Perkins is now walking out. He has his cell phone in his hand and his mask on. The next shot, he no longer has his cell phone because he set it down on the podium. Then you see in this shot, Mr. Perkins has his mask that he's putting in from his right hand in his pocket. The next shot after that, which is seconds afterwards, his hand is again on the podium, exactly where Dave put his hand. My point is, if you're trying to enforce this with our kids, how do you expect them to follow the guidelines if you can't even follow these guidelines? In order to be good leaders, you need to lead. And you just set an example for our children. Like you said, you're so proud of our teachers at this award ceremony. You people need to do the same thing and set an example and be leaders for our children and do the right thing. Thank you.
Thank you, Mr. White. Ms. Haar.
Ready?
Whenever you are.
All right. Hello, my name is Cherry Haar. I have 2 children in the Buckhorn School District, and I'm a cardiac research nurse. I want to know what it will take for this school board to end forced masking. The Madison County COVID dashboard positive cases are down to near zero. They're at 0.02%. Hospitalization for COVID cases are down by 70% as of September, and Governor Ivey is ending the state of emergency on October 31st. All the surrounding counties have optional masking. Why are our children still being forced to wear a cloth over their face? Masks are under an emergency use authorization. Well, how come? Could it be that the current literature does not support the effectiveness of wearing masks for several hours in a public setting? Therefore, the only way that it can be authorized is by EUA. FDA states on their website that cloth face coverings made from common, easily accessible materials are additional voluntary public health approach. Emphasis on the voluntary. Many schools are forcing masks, stating that this is now part of the dress code. If you mandate masks on the grounds of school dress code, then you're saying to students that their face is inappropriate to be shown in public. What message is that sending to our kids? Are you possibly waiting for everyone to be vaccinated? We will never have a high enough vaccination rate in Alabama. Not while we still have folks that remember the Tuskegee experiment that was conducted here in Alabama. If you aren't familiar with the experiment, CDC website gives an overview. 1932, the United States Public Health Service began a study to record the natural history of syphilis. It was originally called the Tuskegee Study of the Untreated Syphilis in the Negro Male. The study initially involved 600 black men, 399 with syphilis, 201 without. Participants' informed consent was not collected. Researchers told the men they were being treated for bad blood, a local term used to describe several elements including syphilis, anemia, and fatigue. In exchange for taking part in the study, the men received free medical exams, free meals, and burial insurance. In exchange for, in 1943, penicillin was given to successfully treat syphilis, but this treatment was withheld from the study participants until 1972, almost 30 years later, when the public learned about the truth about what the health department was doing. Once again, an experiment is being conducted without informed consent. This time it's on our children. Forced masking is against my deeply held religious beliefs. God gave us the best defense against COVID, our immune system. I'm here to say I will not comply with your forced masking. This is my verbal notification to you. I will follow up in writing with an email to the school board and my children's schools. The only other reason this board could continue with forced masking would be that you're in favor of child abuse. This is how our parents view what is being done to our child as child abuse. I request an immediate vote to end forced masking. Otherwise, our only other recourse is legal action.
Kyle Terrell.
Hello, my name is Kyle Terrell, and I have 5 children in the Madison County School District. I have a few in Hazel Green High School, Meridianville Middle, and Hazel Green Elementary. From 4 years old to 17 years old. I could come up here and talk about studies on how masks are useless statistically as far as preventing the spread of COVID. You guys already know this. You've been sent the data. You've read the data. My problem is we're talking about preventing COVID from a standpoint of children who have, like the lady said, such a small, significant amount of severe disease, but yet nobody talks about the severity of what can happen or what does happen to these children wearing the mask all day long. We are also teaching our children to be fearful of something we should not be fearful of to this extent. The country has done this, the media has done this, and you have done this, unfortunately, through continuing to do the mask mandates. My son rides a bus. Oh, I'm sorry, I thought you were fixing to ask me a question. My son rides a bus, and whenever he was on the bus, a young man, we're talking about ages anywhere from 10 to 13, not absolutely young children, tore his mask when he was on the bus. Went to the bus driver and asked, I need a mask, I just tore mine. The bus driver didn't have any. The child broke down in tears, not because he was afraid that he didn't have his mask because of COVID. It was because of what would happen when he got to school. Now, I love the the people that run our schools, the principals. They're all great people. Okay, I'm not saying that they're forcibly trying to scare our children, but that's what we're doing. We're scaring our children. He broke down in tears because he didn't have a mask to go into school. That's unacceptable. It's unacceptable. This is all about choice. We want parents and children to wear masks if they feel that that's the need for them. What we're asking for is choice as parents to not have the mask because we feel that it is very harmful in a multitude of ways. That's all we're asking, is to make it our choice if we want to do that. As teachers, if you're afraid of, or the administration, the people that work at the schools, if they're afraid, wear the mask. If they want to take those precautions, vaccinations are available for that kind of thing. We're asking for choice. That's what we're standing for. When is it going to end? Because it's already, we'll do it now, and it's only going to be for this long. The COVID virus is here. It's not going to go anywhere. When does this stop? When is it enough, is
Thank you,
what I'm
Mr.
trying
Terrell.
to ask.
Thank you. Ms. Cowherd? Just let us know when you're ready.
Okay. I have a question for you today. What is the threshold? This is now the fourth time that I've asked this question. It is yet to be answered. Let me remind you that there were next to no masks being worn before the mask mandate. Why? Parents know that their children are safe without them and healthy enough to handle COVID if they were to get it. Parents understand the facts of COVID and were capable of making that decision. For the umpteenth time, this is not your decision. This is our decision as the parents. When Mr. Perkins decided that our children should wear masks on 8/12, Madison County Schools had 207 positive cases, 182 students, and 25 staff, an infection rate of 1.05%. I got this information directly from the lead nurse for Madison County Schools on 8/12. As of 2:30 p.m. today, 34 positive cases, an infection rate of 0.17%, 27 students, and 7 staff members. A new school year begins and kids get sick. It happens every year. This year is no exception. But specifically to COVID, the numbers do not warrant masks, never have. I've spoken to several teachers in Madison County and a couple from the Buckhorn family. They say things like, quote, we feel helpless, quote, maybe it will end soon, or quote, do you know how much it means to a student to see a smile on the face of their teacher while welcoming them to the classroom? Because I do. Mr. Perkins, today is the day to end the mask mandate. We have been patient, but it is wearing thin. We knew that it would only be about a week or so before our children were expected to mask up, and we were right. Mr. Perkins, it's time to start working with your school board members. School board, it is time to start representing the parents in your districts and fighting for them and their children. Parents concerned about COVID had a virtual option, and they can send their kids to school in masks all day, every day. But your message has been loud and clear. You'll do whatever the Alabama Department of Public Health tells you to do. By the way, their guidance is nothing more than that. It is guidance. That is it. We're already preparing ourselves for the next mandate, COVID vaccines, and it sickens me to even think of that as a possibility. But let's now acknowledge something. Praise God that COVID has a high survivability rate and that it's even higher for children. It's time to stop this nonsense. Enough is enough.
Thank you, Ms. Coward. Mr. Coward.
Let's see. First, I'd like to say thank you for the teacher that actually came up here and spoke today. That's very hard to do as a teacher because nobody wants to come out and speak out, especially in front of the central office that may take precautions or whatever against her. Here again, we're again to talk about the overreach of the school board. As Mr. Weiss said, the school board and central office are here to provide students with a safe as an environment as possible, safe school environment as possible, but not a risk-free environment. We take risk every day. Some take risk more than others, but it's the individual's choice. Some have said that we have options to homeschool. We have the choice to private school. Well, they do have the same options, but they argue they don't have the financial resources. You think we do? We just choose to make that sacrifice. Many of us have asked for the threshold of what it would take to take the mask off these kids. We should not have to be asking this. It should be our choice, period. We now know what the answer is on why you want these kids to wear a mask. It came straight from one of your school board members. They said it has nothing to do with whether these masks work or not. It's all political. When there's federal money involved, we'll always side with funding. So even if the government is pushing something that is wrong, the school board will side with funding. Big problem. We all know what's next. It'll be a mandate for school children. Why? Less than 0.25% of school-age children are dying from this. A local doctor, Mr. Calderwood, said that it's best the kids are not vaccinated. 1, the vaccine does not stop you from getting it. It reduces your chances of getting a severe case and being hospitalized. Well, kids are not flooding the hospitals. 2, the viral load is the same if you're unvaccinated or vaccinated. 3, kids are not dying from it, so why should we vaccinate kids on an unproven drug? Because they can still pass it to someone whether they're vaccinated or not. Did you hear that? Everyone can pass COVID no matter if you're vaccinated or not. These masks are a joke. I have 2 kids that are children that are been removed from Madison County schools. They're in different private schools, never been required to wear a mask. Guess what? There has never been an outbreak of COVID in either of their schools. It's not just their schools that show this. There's scientific data supports this, but it's dismissed by you and the government. And that's all I really had. But Mr. Weiss, I appreciate what you said about taking up against the DOJ. I really appreciate that. Thank you, school board, for that too.
Thank you. Sarah Yeldo, Ms. Yeldo.
All right, ready? Last time I spoke to you, I talked about layered protection for COVID prevention. And tonight I'm here to talk about a case study that demonstrates the need for that layered strategy. The Tuesday before fall break, my daughter, 10 years old, came downstairs at 4 a.m. very sick with what was determined later that day to be COVID. It came on fast. The day before, she seemed perfectly fine. She went to school, she had a great day, she went to choir club, sang her heart out, came home, rode bikes with the neighbors until it was time for dinner. All entirely symptom-free, and all while being very contagious. In the week before she got sick, she was exactly in 2 locations outside of our house. She was at school, and she went to a school-sponsored event at Sparkman High School. We did not receive an exposure notification from either place, so we had no idea that she'd been exposed and needed to quarantine. Because she was symptom-free, and because we had no idea that she'd been exposed, she was at school on Monday. The reason you did not see a COVID outbreak in Legacy 5th grade or in the Legacy Choir Club is because she was wearing her mask, and her classmates, more or less, were wearing theirs. As I've said before, no COVID prevention measure is 100% effective. Parts of the system will fail. My child was contagious but pre-symptomatic, so screening measures would not have helped. Contact tracing failed. A contagious child ended up in the middle of a bunch of other kids. In her case, what prevented an outbreak was the mask requirement. My daughter did manage to infect one of our neighbors. That child became ill 4 days later. In that case, further spread was prevented by the exclusion policy. When that child became contagious, finally, they were not at school. It was the contact tracing and exclusion policy that prevented further spread. You cannot rely on just one measure with one point of failure. Until students are vaccinated, we need a combination of protective strategies. We need masks and exclusions, and screening, and distancing. I would like to see additional measures, such as pool testing. That or some other method of early detection would let you relax some of the measures at the low-risk schools and would allow you to make reasonable accommodations for the students that need them. If my child had not been wearing her mask, you would have many more sick children at Legacy. In this case, the mask requirement worked where the other measures failed. COVID is not over. Your policies are working to keep cases down. Granted, my daughter's case is just one data point, but how many cases do you really need? Thank you.
I'm going to go back up to the front because I think we had some folks that came in after we started. Miss Belinda Newell and Miss Claudia Gilbert. Did any of them? Okay. Well, thank you all again very much for coming in. As I stated before, we appreciate the fact that you're here. It does show that you're extremely concerned about and engaged in your children's education, regardless of what side of the debate you're on. We appreciate that you're here. We are going to have a COVID discussion here in a moment, so I would encourage you to stay here and listen to what Mr. Perkins has to say and what the board will be discussing. But again, thank you very much.
Austin, you want to go ahead?
You already did. Oh, he didn't. I'm sorry.
Austin, you want to go ahead and pull that presentation? Okay, informational items. Just a COVID update. Kind of want to talk about where we've been, where we're going. Want to talk about a plan that we have that we've been kind of looking at, been talking about, and the PowerPoint presentation will actually speak to that. So what I want to do is to recap our school year up to this point. So August the 3rd, the board approved our Ready, Set, Forward plan. Plan that was put in place so that we could safely open our schools and have a safe environment for our students. August the 4th, first day of school, we started at level 0 with masks being optional. That was our intention when we started, and so that's the way we started. August the 13th, we saw a significant rise in cases, 251 cases. So based on the level of spread and how the cases were moving and the wideness of the spread, we decided it would be best for us to move to the ADPH guidance with masks being mandatory and then exclusions of students. August the 30th, and I have it on my computer so I can actually look at it. Oh, you're good, you're good, you're
Move
good.
back, Nathan, move back.
You're good. August the 30th, positive COVID cases peaked to 674 students and 64 staff, which was a total of 738. September the 3rd, positive exclusions peaked, and the positive exclusion represents those students who were in close contact with those students who were positive. That was 2,070 students. September the 7th, and these are just waypoints that we've looked at as we examine the data. And we examine the data, I'm not going to say every day, we examine the data multiple times every single day on weekends just to see if things have changed. September the 7th, COVID numbers began to fall for positive and excluded students. So if you go back, August the 13th, we saw a spike. We went to the mandatory mask based on ADPH. September the 7th, those numbers started to fall. September the 17th, we had 663 excluded students and 161 positive students. On September the 24th, we had 529 excluded students, 102 positive students. October the 1st, 456 excluded students and 74 positive students. And as of today, when I pulled the numbers, we have 81 students excluded and 27 positive students. Now, there's a gap, of course, because of fall break. So we didn't take the numbers for fall break. From last year to this year, these are the data points that we've used. We've used raw COVID numbers. That's the number of just raw COVID cases that's within our system. We looked at our system numbers. We looked at community numbers, just the raw COVID numbers. We looked at percentages of spread, the percent of COVID that spreads within our system and outside. We looked at faculty and staff, and is our school operationally sound? Did we have the staff in place to be able to function at a high level within our schools? We looked at hospital capacity. And this is not just, when I say look at hospital capacity, this is in consultation with hospital administration officials to make decisions. We look at Madison County direct community spread. How is it spreading, or what does it look like within our community? And then, of course, we utilize and we look at the ADPH data and the information. And I didn't have this on there, but State Department guidance and guidelines, we actually took that information as well. So whenever we made a decision was made, and it's always made based on multiple data points when we make these decisions. And then at last, we look at the Madison County area community spread rate that's actually found on the data and surveillance dashboard. And that's not something that that's only one point, there are multiple points. Even in those data points, we drill down to, let's say, raw numbers or percentages. Is the spread in a school because of an athletic event? Is it just a cheerleading squad, or is it just a wrestling team? Where is that spread actually coming from? And if that spread is coming from a localized or a small area, then it impacts the school in a different way. So that's some of the nuances of looking into data and how we make decisions based on it. Priority. Our priority, my priority, has always been safety of students first. This is before COVID. This has nothing to even do with COVID. Safety of our students, our faculty, and our staff. I feel like we have a moral obligation, always have had a moral obligation to do what is right for our students. Now, does that look differently between different people when they do? Yes, everyone has different opinions. But I always go by the quote that I stand by: higher than the highest human thought can reach is God's idea for his children. And that puts in my mind that I have an obligation to do the right thing for our students. And that's what we always do. We always focus on doing that. That's what the primary focus, what we always look at when we are making decisions, is to make sure our students are safe, make sure our students have what they need within our buildings, and our faculty and our staff as well. And then the second priority of focus is to make sure that we can keep our students in school, in person, as much as we possibly can. And that has been the goal from the very beginning. So there are several masking options. And so the ADPH, back to school guidance, is an option. 2021, 2022. This is an option that they presented to us as school systems. It is a recommendation. It is not. It's basically a recommendation, and the recommendation is masking of students is recommended, and then the excluding of students is recommended. It's a layer of protection. But there's another option that we've been looking at. That I've actually kind of gone through and kind of put some waymarks in place as we work towards some type of normalcy within our district. And so option 2, we will review numbers for the next 2 weeks to make sure there is no significant rise in positive cases due to fall break. When I looked at our data from last year, generally there was a spike, a rise in cases around those breaks. We want to make sure that there is not a rise in cases at fall break. Beginning Monday, November the 1st, if positive COVID numbers remain low, remain below 0.5% system-wide, we will first remove exclusions from our current protocol. And the removing of exclusion gives us the opportunity to see the percentages in terms of those students who are affected by students who are positive. After the 2 additional weeks of analyzing that COVID data, if positive COVID numbers remain below 0.5% system-wide, then we will move to level 0 or level 1 with masks being optional. In our COVID plan, in our Ready, Set, Forward plan, at level 1, we have the option of level 1 without mask or level 1 with mask. So based on the data, based on the numbers and what we look at, if our system remains below 0.5% system-wide, then we'll either move to level 0 or level 1, mask being optional. And then mask option 2 continued. If the system moves to level 0 or level 1, mask optional, masking and exclusions will be on a school-by-school basis using the following criteria. So that if an individual school reaches 2.5% positivity rate, they will move to level 1 mask required and exclusions for close contacts. And then we will return to mask optional for that school once their positivity rate falls below 0.5% for 5 consecutive school days. Where does the 0.5% come from? It's just basically trying to create a baseline from looking at our data. And as we look and track our data, the data shows that 0.5% is a number that our schools can reach. We have a number of schools right now who are below that 0.5%. So that's the progression of where we're looking at a step progression to move towards mask optional or to move to level 0 or level 1 mask optional. Any questions?
Well, first of all, I want to thank Mr. Perkins for working diligently with the board. We approached Mr. Perkins several weeks ago and believed, just like many of you believe, that we needed to have some sort of data point. We needed to have some sort of, with lack of guidance coming from the public officials on what is an acceptable rise or fall in COVID in schools, we felt that it was needed in order to give you all, the parents and the stakeholders, an expectation of when we may or may not go to mask versus just we're doing it just for the case of doing it. And we've been back and forth on this. Mr. Curry and I, as president and vice president, have worked very closely with Mr. Perkins and his staff, and we've been back and forth on it, and it hasn't always been a pleasant conversation. But I mean, I appreciate the fact that we've been able to work through this. I think this is an excellent starting point. I would toss out one thing, and then I'll let the board as a whole talk about it. I mean, our numbers are way down right now. And I don't know if maybe we want to consider lifting the exclusion starting the 25th of October and going to level 0, level 1 on the 1st of November, or if we want to continue to keep the plan as is. And I know you and I talked about that this morning, keep about the plan as it was, but then the numbers came out this afternoon, and I think we were all very surprised at the numbers. And I realize that whatever plan we put out there, it's not going to satisfy everybody. But it's a start, and it's a way to give people some sort of light at the end of the tunnel, an expectation. If you see on the COVID dashboard that numbers are starting to go back up at Walnut Grove, Newmarket, Central, Madison Crossroads, Monrovia Middle, whatever the case may be, you know that if they continue to climb, that masks are going to be mandatory again. You know that ahead of time. It's not going to be a surprise. You're not going to get a phone call 24 hours prior, and you know it's going to be coming, so you can prepare for it. And I think that's what we owe you all as the leaders of the system, is to provide at least some sort of level of expectation. And so I'll open it up to the rest of the board to discuss the plan, and then we can move forward.
And I do want to wanted to make sure that everyone knows, the board knows, well, and you all know this because we've talked about this ad nauseum for months and months and months from last year, of looking at data points and trying to decide on what that threshold or what that number would be. And because there was so little information, even healthcare professionals have not come up with a number. And so we've poured over numbers, we've played with numbers, we've added numbers, we've taken numbers away, we've looked at each one of our schools to see what the school numbers look like. And this is something we've done from last year. And so from last year, the thought was, okay, you know, this is our data point. We're using so many different data points. It's going to be a little bit difficult to actually zero down to a specific number. We have, and myself and other superintendents have asked for specific numbers to actually give us an idea of what that number would be as we move towards one level to another, masking or not masking. We've asked for that guidance, and of course, it's pretty tough to try to make a number for an entire state or things of that nature. So we've had conversations about that, but it's been an ongoing conversation for not just this year but last year as well.
And I would say we've based our plan very closely off of what Hoover City Schools have already gone to. I believe they started this a while back. I mean, they've already been using this.
They did start this.
Yeah, so, you know, Hoover City Schools is using this. I think Baldwin City has lifted their masks. So, I mean, it's starting to become apparent throughout the state that we need to put something in place to give people an expectation and put out some sort of percentage so that we can use that as a data reference point versus just, okay, we got to mask up. That made no sense, and we felt we needed to get beyond that and be smarter, and hopefully this I'll open it up to the rest of the board to discuss with Mr. Perkins.
Can you go back to the slide that had the dates and the please?
Whoops.
I'm sorry, I didn't say which dates. The dates of the plan for when to start considering 25th, 30th. Yes, ma'am, that,
Yeah. The first was the initial date.
Yeah, the first is the initial date.
correct. And Dave, what you're saying, and I'm sorry, I'm looking down at a calendar here.
Well, when I talked to Alan today about this, I was in agreement with this, and I thought it was conservative, and I thought it worked fine. But then when we saw the numbers come out today and the drastic number just decrease between even yesterday's numbers and today, I thought, well, maybe we could move it up to the 25th of October, which is a week from this Monday.
Well, I do want to just simply say that, taking into consideration fall break numbers, each
Well, that would still give
each
us another
break-
week. That would still
it
give us
gives
another week.
Right, yeah. Each break, I want to make sure that there's not a significant increase because of fall break.
And I
And
don't
that's the only
disagree.
reason
And I
why
don't
I put
disagree.
that
But I
in-
think
in
even
that
if we
way.
moved it to the 25th, that would be a two full weeks of school with a weekend in between. That's 12 days.
Well,
We
it's
should,
14 days from the day you returned.
yeah,
Mhm.
so 14
14
days.
days,
So I
yeah.
think that would be we'd have a pretty good, fair idea of whether the cases are going to spike or not. I mean, I think by middle of next week, we would know.
And on that day, if we went, that would be to remove exclusions.
would be to-
Exclusions, just
to
remove
remove exclusions.
exclusions. And then the following Monday, the 1st of November, we would then go ahead and begin the level 0, level 1. Thoughts?
I just feel like this plan right here is, hate to use this word, but kicking the can down the road again till Thanksgiving.
Well, that's kind of why I suggested we maybe move this up a little bit closer to the 25th and the 1st, so that gives us a little bit more time before Thanksgiving break is starting the week of the 20th of November.
Right, but if we say we go with this right now, and it's November the 1st, that would be number 3 down there. We would remove exclusions, and then we're going to do that for 2 weeks. So that's putting us around the 15th before we can even talk about mask optional.
Well, if we bump it up a week. and
I know, I'm
start-
saying, but
start
right
exclu-
now, I'm
Right
just
now,
going with right
based on
now.
the plan now, but if we bump it up a week and start the exclusions on the 25th of October, we would go level 0, level 1 on the 8th of November, which would be 2 weeks before.
But what number are we? I appreciate the low numbers today, and they were great. What are we going to consider a spike from 27 kids?
Well, we'd have to base it off of
Anything over 0.5.
0.5% or 2.5.
So it could get back
School.
up to 150 kids, and it still wouldn't be a spike.
Depends on what school and how many people are in that school, because it's a percentage.
And so the 0.5% starts with our
System-wide.
district. System-wide.
System-wide, and 2.
I'm talking about system-wide.
Yeah, 0.5% system-wide.
What's that number in?
I don't know.
20,000 students. How many?
Yeah, it's very low threshold. I mean, we'll admit, it's a very low threshold, but I mean, again, it's a start. And we can see, okay, well, maybe that's too low. In fact, we had this conversation today about Walnut Grove. I mean, 0.5% at Walnut Grove is one kid, one case.
1.7.
So that's kind of why we went to a 2.5% at an individual school, so we can kind of, we're not masking up every other day. So, I mean, we kind of figured that out, but
And 0.5 is attainable. I mean,
Yeah.
when you look throughout our district, that is an attainable goal.
Yeah, you and I talked about that earlier, and, you know, the question I have for you is there any way you could accelerate this timeline if possible? But you have a 2.5% at each school, so even if they exceed the 5%, and, well, let me ask you
So
this back a little bit.
2.5% is if a school goes,
Past the
have a
point,
breakout and they have 2.5% breakout,
correct,
then they would go back to mask until they get back down to 0.5%.
okay. What's our running average right now on per school basis roughly? We're at 0.1,
Yeah, we have 0.3, 0.4. It just depends on school. I mean, that's,
have we been at each school under 0.5 for a pretty consistent amount of
Yes.
time? Okay.
yes. There are some schools that have not, that are close, but the most of our schools are
So
close enough.
if you started today on step 3, every school would be mask optional at this point.
At step 3,
If we're
no,
at
there will be probably, I think, 6 schools that would not be.
Okay.
and obviously, yeah, the larger the schools are.
Yeah.
I think I can agree with Dave that 10/25 is, 14 days past the return is probably not a bad time frame to look at beginning the process here of number 2,
Moving the exclusions on the 25th
and then moving that time frame back.
back up, so removing or going to level 0, level 1 by the 8th of November.
Yeah,
Yeah.
because I think if you couple that with our community spread and look at how that's going, if they're matching that trend, then we should be in a position.
And these are numbers and dates, and that's there for discussion, so I wanted you all to discuss it, so.
Right.
So are we going to be looking at community from this point forward, or are we just going to be looking at what we see right here?
I say we look at what we see right here.
Agreed.
I don't think we muddy it with more data than necessary, in my opinion.
I'm okay with that, but
I was just saying, that was just kind of an example. I wasn't saying that we should necessarily do that, because the other thing, I think the thing that we have to consider also as a priority is keeping kids in school. So if we reach a break point where attendance is to the point, that we can't maintain in-person learning, that's kind of needs to be part of our priority, is keeping kids in school.
Sure.
And so I think if we look at 10/25 beginning exclusions, at least then we're keeping more kids in school.
The board doesn't accept questions from the audience during the board meeting.
I'm saying.
You can ask the superintendent after the meeting. You can ask after the meeting. You can approach the superintendent after the meeting and ask, this is his presentation.
Would we be willing to do anything for the schools that have 0 cases right now earlier? Could start with those? I mean, since we're not going system-wide again, and we're going school to school, does that make sense?
We don't.
Yeah, but I understand what you're saying. However, we're trying to take a systematic approach to this and looking at data to make sure that we don't have additional issues.
And by today's numbers, do we have
Today's
Well,
number
several
of
of
2 point,
that have 0?
Huh?
we have 27 students today.
We don't have
We're
any
below,
of those
we're
0?
below 2.5. We're below 0.5%.
Yeah.
System-wide, and we're about. You said I think there's like 5 or 6 schools that are just at the
Who is that?
2.5%.
Yesterday, am I looking at yesterday?
Hazel Green Elementary has 0.
I mean, I think the spirit of what you're
Are we
trying to
talking
do,
about
Alan, is you're trying to phase it in, is what I'm
Yes.
seeing.
I was
You're trying to
going
by
phase
the
it.
numbers.
Yeah.
I think
Those are the numbers.
I think pushing it. I mean, Dave's point about pushing to
Gotcha on that.
October 25th.
I was going back.
maybe, I guess that gives us a week earlier. But I see you're trying to, so assuming that masks have some value, which I would say that there is some marginal value with masks. I mean, I think there has to be, of course, I'm an IT professional, so we look at layered approaches when we look at remediation for viruses and stuff like that. So there's multiple inputs that we look at. So I'm not saying masks are the answer by no stretch, but I would say they probably do provide some measure of benefit that results in a decrease of cases. So I see you're trying to phase it out to a point where they're optional. And I think it's solid. I would agree with Dave, though, maybe looking at pushing that up a little bit to see if we can expedite, since we're way down and we hope to not see a trend in the other direction. I think that's appropriate.
When we came back, or when we started school, we began to see the trend after 5 days, right?
Yeah.
We started seeing a significant increase, and when you start comparing us to other districts that were already masked in the beginning, they did not have that rise that we had.
Right.
And they never reached the numbers that we
could see
reached.
what was happening after 5 days.
Yeah.
You're talking about when we came back
From-
in the beginning of this,
summer.
okay, I'm sorry, I thought you meant when we came back Monday, I was like,
No, I'm talking about just trying to parallel it back. So we saw
Yeah.
we had a problem in 5 days.
yeah, I think we were double Huntsville City within 5 days.
Right.
Who
So would
was
we
that?
not see that same issue this time in 5 days?
Not
Maybe we could-
not necessarily. And the reason I say not necessarily is you had the summer, and the summer was, we had mask optional in the summer for our summer learning programs, but we had fewer students, those things. Moving, I don't think the trend is the exact same coming from the summer as it is coming from fall break. I'm not sure if we would see that same trending or spike in numbers after 5 days. Usually, after those breaks, they had a peak, a growth that was significant enough to say, okay, we might need to look at pushing out past the actual break by 2 weeks to see exactly where we are. And that's the reason why for the fall break, just making sure that our numbers don't spike and that we don't have any issues whatsoever.
Again, I think 2 weeks, going to your point, I think 2 weeks by the end of this week, beginning of next week, we should have a pretty fair idea if we're going to start seeing a significant spike. We would already start seeing numbers creeping up by the end of this week, beginning of next week.
I think, well, because what you have is, when everybody was separated, and come back together.
Yeah.
It's going to be 4 days at least.
4 to 5 days.
You're together, and then those are going to have another
Another
set.
5 days.
So you're looking at 8 to 10 days, and then you add another 4,
But-
and 2 weekends in between, really.
We could say October 25th, and then if by the end of next week our numbers are creeping really higher again, we can always adjust fire as necessary. But I think 2 weeks should give us a fairly good idea of what, and the trend statewide is way down anyway. The trend
Right,
is
and that's
starting
kinda what I meant.
significant.
We have, for the most part, always kind of matched
Yeah.
what it looks like if you look at the trends in the community.
Right.
That's kind of what I meant, is if you kind of overlay our spike and fall, it's similar, and so
Mirroring that,
you have
Well,
that.
I'm thinking you might be even more aggressive, because in the summer, we were seeing everything going up, and ours went up too, and now we're seeing everything go down, and so we would expect ours to go down too.
So you could say you'd want to see it lifted next Monday?
I'm saying you can make an argument. For
Yeah, you could. I was just being
Actually,
I was just
if
being
you look at the
conservative.
numbers today, we don't really have a problem at all. But, of course, you could also make the argument that the reason we don't have a problem is because we are doing all these things. So, it's really kind of an experiment.
And I think that's the point here. I think we're just we're trying to do something that isn't out there already. We're trying to make a plan that's not already out there for us to use. So we're kind of the pioneers of this within our community. Again, you can make an argument next Monday. I think if we wanted to be conservative, we could start it on the 25th, and I think that would be, for me, that would be just, yeah.
You could definitely
Yeah,
push
it's happy, it's in between the 1st of November and next Monday, and I thought the 25th would probably be
Well,
So-
and again, I mean, I definitely can take that in consideration, bring it back, for the board to vote on
Yeah, I
it.
mean, if we,
I would
well,
say
we don't meet
that
again until the 28th, but I mean. if we-
26.
26, but I
Yeah.
mean, if we needed to, we could come in next week for a quick,
Yeah, we could maybe,
Yeah, we can meet.
we could always come back in for a quick special session to approve this.
and
Yeah.
not do our 7 a.m. meetings, they make me.
And so between now and then, if we're coming back and we see that they're even better than they are today,
We could make the adjustment on the fly at that meeting and then just vote then.
I mean, it's, because masks are hurting things as much,
Yeah.
they're not good. I mean, they hurt learning, they hurt teaching, so we need to get rid of them if we can.
Well, and I do want to just simply say, it is definitely a layered approach. I don't think one thing is the all in all. I do think that our numbers are low, and when we started in the beginning, our numbers were not low. I think that taking a layered approach and being cautious and moving in a cautious way is just the best way to go about it. And I'm not saying we're moving, and we're not moving to not do it. We're moving to move in a certain direction. And so that's
Is there any
that's me.
objection then to leaving the plan as it is right now and coming back in here a week from today on the 21st for a special session and then modifying it based on the numbers? Is there any objection to that from anybody?
So if the numbers are better, we definitely go with the 25th.
Yep.
Or-
If the numbers are better or haven't climbed, we automatically just bring it to, so that gives us a little bit more time, and then we can come back in here and we can make that determination and vote on that next Thursday. I think that would be a good way to look at it.
You're going to have to say that again. for me.
So what I'm saying is, we go ahead and, we don't make any adjustments tonight.
Okay.
We come in here we monitor for the remainder of this week and up through next Wednesday. We come in here next Thursday with altering the plan and beginning the masking option number 2 on the 25th of October, not the 1st of November.
You mean with the exclusions, starting with the exclusion on the 25th?
Right.
But that doesn't do the masking option then. That's still 2 weeks behind, right?
The mask would come off on the 8th. potentially.
Of November,
You can
if we
one
move back.
layer at a time.
25th.
Right.
And we'll just kind of give it a look-see for the next couple of days and first part of next week. And then we come in here on the 21st, and if the numbers are continuing in the right direction down or stabilized, we go ahead and adjust the date.
Yeah, because if we're going to meet next
Thursday, the
Thursday,
21st.
we would need to announce it tonight. Don't we have to give 7 days notice?
24 hours, 7 days?
7 days.
For a
unless
regular
it's
meeting, but if it's a special session, it's 24.
Only if it's emergency.
1 day.
But we're gonna, just from my understanding, I know I asked a lot of questions, but we're gonna go by the 0.5% because if we're at 27 now, we come back next Thursday and it's 30, you can say numbers went up.
Oh, but you're still under the percent.
Still under the threshold.
That's what I'm saying, we're going by the threshold.
Going by the threshold.
Okay. I could do that
Yeah,
then,
the
yeah.
the thresholds are not changing, just the dates potentially changing.
I could get along with that if we had a set number.
You
Well,
okay with that?
that's-
Yeah.
Okay. All right.
All right. Informational item B, text, well, let me just stop. I'm not sure if you all would want to stay for a textbook and all of that.
I just told him I wanted
I
to
don't
stay
mind
for
you
the
all
meeting.
staying. You all are welcome to continue to join us the rest of this meeting, but if you would like to leave, you're free to.
Alan, I know you had a couple of questions out here. Do you want to take a 5-minute recess? And
I'm fine with that. I mean, it depends on if
We-
that's in
Is that
protocol.
okay?
We can take a 5-minute recess, and if any of you have any specific questions and you'd like to ask Mr. Perkins, we can do that. So do I have a motion to take a 5-minute recess?
Motion?
Second.
Second. All those in favor?
Aye.
Aye.
No.
I just want to thank you, because every minute that you wait to change things,
I have enough.
Information on item B, textbook committee nomination.
Boom.
Ms. Fisher? Ms. Fisher.
She was here. Where's
She
Karen?
was.
Karen. I'm dying. It's hot in here.
Record 19. You know we're live.
Okay.
That's excellent.
He started it. I'm going to blame it on him. Yeah, he did.
Good evening.
Hey, Karen, how are you?
I just have a quick couple of purposes here. I just want to give you some overviews of our proposed textbook committee and to answer any questions that you might have. The roster that you have is just under 70 representatives. There are representatives from every school in our district. We have 14 parents who have been selected for the committee, including someone from every feeder family. There are 7 reading specialists and 1 middle school academic coach on the roster. We have EL and special education representatives, 2 building administrators, elementary and secondary specialists. We are looking to adopt the highest quality instructional materials for our ELA adoption coming up, and that is the charge that our committee will have. Are there any questions I can answer for you tonight? Okay, thank you. Good evening.
Thank you.
Thanks, Karen.
Thanks.
Very succinct.
Informational items, entrance fees, adjustments for athletic tournaments. Dr. Minsky?
Thank you. I was approached recently by one of our coaches that at the high school level asking if there's a chance that we could look at modifying our entrance fee for tournaments. Basically, their concern was the fact that, one, the cost of referees, officials, and things have gone up in the last couple of years. And when they're traveling to other tournaments in the area, the other school systems are charging $10, $11, and $12. So the proposal we're going to be bringing forth at our next board meeting will be a request to increase the price with the terminology. It's currently $7. We're going to ask for schools for tournaments to be able to move that up to $10. So if a school decides they just want to keep it where it is, they may keep it where it is. If they determine they want to move it up to $10, they may move it up anywhere within that range. So that is the request.
Tournaments only, or?
This is for tournaments only, yes. For tournaments only. The regular, and this has to be approved. It's in part of the financial guide, is why the board would have to approve this. The cost for adult tickets and student tickets for regular games will stay the same.
All the money outside of what is paid to bring in the referees and umpires, all the rest of that money stays at the local school, correct?
I'm not sure your question. So if they whatever the gate fee is for that, yes, that is for them.
Yeah, whatever the gate take, the total
Right,
gate
whatever the
take,
gate takes in,
whatever
yes,
they
sir.
have to pay for the referees and umpires, the rest of that money stays at the local school.
That's correct.
Okay.
So have the rates gone up in regular non-tournament times? Have we had rates increase for umpires and referees?
Yes, it's not just, rates have increased for every time they come, but what they're seeing the hit on is the tournament piece as well, because they're having to get more people throughout the day to cover multiple games. So this way.
It's not an issue in the regular season?
Well, they have some of the things they have other funding sources. Part of it's the fact that they go to a game in a neighboring system and they're charging $11 to go to the tournament, and then parents come to our schools for a tournament, and those same parents that are the away team are paying $7 now.
Gotcha.
So the goal was to try to get that to be a little bit more equal from some of the other tournaments. And again, this is just tournaments. Typically that'd be a basketball tournament, over a holiday tournament, weekend tournaments, those type of things.
Okay.
Am I looking at this right? The one on the left is what it's costing now, and then the one on the right is what it went to, like from 60 to 80?
Yes, correct.
What it will go to.
Well, it's what it currently is, and then they're going to be raising them.
Yeah.
So yes. So again, all of our middle schools and high schools charge $7 for any tournament that they have for admission fee. And the request is, again, with the term up to, so they don't have to go up to $10, but they are able to if they choose. And this was actually proposed by our high school principals, brought this forward.
If you have a season pass, do you get in the tournaments?
Usually they exclude.
Yeah, tournaments are typically separate from that.
What I was saying is like if it's $60 now and it's going to or is 80 and you raise it $1, the first 20 parents are going to cover that. You know what I'm saying? I mean, we were going like $3.
Again, this is just for tournaments. This isn't
Okay.
for regular season games. Everything would stay the same. This would be for a weekend. So if New Hope has a weekend volleyball tournament, they would charge that fee for everybody who came to the tournament.
I got it.
Any other questions? All right. Thank you.
Thank you, Mark. You're on.
All right. Administrative items. Item A, I recommend approval of the August 2021 financial statements and payments of bills as submitted.
Motion.
Second.
A motion and a second for the recommendation and approval of the August 2021 financial statements and payments of bills. Any questions or discussion? I believe Karen's online as well, if you have any questions for her. If there are none, all those in favor, say aye.
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 Item B, I recommend approval of the Madison County Schools bank depositories as submitted.
Motion.
Second.
I have a motion and a second for the recommendation and approval of the Madison County School Systems Bank depositories as submitted. Any questions on that? There are none. All those in favor, say aye.
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 Item C, I recommend approval of a bid tabulation for Madison County High School fluid cooler as submitted.
Motion.
Second.
I have a motion and a second for the recommendation and approval of the bid tabulation for Madison County High School fluid cooler. Any questions on that? If there are none, all those in favor, say aye.
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 Item D, I recommend approval of the contracts for services as submitted.
Motion.
Second.
A motion and a second for the recommendation and approval of contracts for services as submitted. Any questions? If there are none, all those in favor say aye.
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 Item E, I recommend approval of the personnel items as submitted.
Motion.
Second.
I have a motion and a second for the recommendation and approval of personnel items as submitted. Any questions? Yep, Ken's online. Hello, Ken. He looks like he's half asleep. If there are no questions, all those in favor say aye.
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 Item F, I recommend approval of the supplemental contracts and discontinued contract as submitted.
Motion.
Second.
I have a motion and a second for the recommendation of and approval of supplemental contracts and discontinued contracts as submitted. Any questions? If there are none, all those in favor say aye.
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 Aye. All right, that takes us up to an executive session for a unique transfer request, pending litigation as well, and we have a certification for both of these. Is there anybody that needs to say anything before we go adjourn into executive session? Okay, then I will entertain a motion to adjourn into executive session.
Motion.
Second.
I have a motion and a second to adjourn into executive session. All those in favor, say aye.
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 Aye, and we'll just stay right in this room for that. And we're